tonight, helping Texas mothers.
I don't know what I'm going to do about insurance because I still have, the ongoing health issues.
How one initiative in the state house could save lives. Plus, Texas Attorney General Ken Paxton talks to lawmakers about immigration policy, what he thinks the state could do to expand its power over the border, and an uncertain future for LGBTQ Texans.
Just the stigma that comes as a result of debating someone's humanity publicly.
How dozens of bills filed in the state legislature could have a major effect on the community. Capitol Tonight starts right now. Hello and thanks for joining us here on Capitol Tonight. I am Rena Diamante in for Karina Kling. A new report found more women in the United States are dying of causes related to pregnancy. The CDC released data showing around 1,200 women died of maternal causes in 2021. That's compared to about 860 in 2020 and 750 in 2019. The report says the maternal mortality rate has been climbing for decades, but it's unclear right now how much COVID-19 played a role in the spike.
During 2021, we saw the Delta variant, which was predominant, which really affected pregnant people, both in terms of maternal outcomes, but also pregnancy outcomes.
The most recent Texas data found 141 pregnancy-associated deaths in the state in 2019. Experts reviewed 118 of them and found 90% of those deaths were preventable if there had been feasible changes to their health care or other circumstances. There is an effort underway in the Texas House to extend Medicaid coverage to 1 year for new moms, as millions of Texans are at risk of losing health care coverage. That's because the federal public health emergency declaration is expiring. Charlotte Scott spoke with one mother who's worried about no longer having insurance.
Connie Bunch is a single mother of two. Her youngest, Aiden, is just 15 months old. Her daughter, Brooklyn, is 10 and has cerebral palsy. She requires frequent care, and Bunch is often taking her to doctor's appointments far from home. Because of that, she doesn't work.
You figure it out. You do what you have to do. You tough it out. Those are my kids. I love them.
Before the pandemic, Bunch didn't have insurance. But when she got pregnant with Aiden last year, she enrolled in Medicaid.
Anybody that was on Medicaid March 2020 is still on Medicaid. Anybody that has come onto Medicaid since March 2020 is still on Medicaid. What that means for Texas is we have about 5.9 million people on Medicaid right now.
A pandemic-era federal health order allowed new moms to stay enrolled in Medicaid longer than 2 months, which is Texas's coverage limit. The legislature passed a bill last session to extend Medicaid coverage from 2 to 6 months, but it hasn't been approved by the federal government yet.
Now, Dallas area Representative Tony Rose is trying to increase the length of coverage to 1 year. She plans to go through a different application process so it's not held up again.
I think it continues to be an easy way to support moms in that really crucial first year of life.
With her insurance, Bunch could continue to go to the doctor after a traumatic delivery, and she discovered many health issues that had been ignored for years, like high blood pressure and diabetes. She also went to the emergency room when something didn't feel right. A doctor discovered aneurysms.
Untreated, that could kill me. And I wouldn't have known because I didn't feel comfortable going to the ER.
Bunch is expecting to get kicked off Medicaid in April because the Biden administration recently announced it's ending the COVID emergency declarations. That means for the first time in 3 years, the state will begin taking Texans off Medicaid. For Bunch, that's scary. She has a surgery scheduled for March 28th.
I have no idea what I'm going to do for post-op care. I cannot afford to pay for it out of pocket just yet.
Bunch says having insurance was life-saving. She hopes the bill passes so other new moms can have the support she did.
I'm still able to get all of my medications, my surgeries, everything that I need right now. Not sure what I'm going to do when it's over.
For Capitol Tonight, I'm Charlotte Scott.
Joining us now for more on this is Udoak Nakanga. She's a policy associate at the Fios Center. Thank you so much for your time. What's your reaction to this new data from the CDC showing this rise in maternal mortality across the country?
Thank you for having me. So to start off, I would be lying to say if I was shocked. This is an ongoing issue we've been seeing and speaking about here for years now, especially here at the Fios Center. Women continue to die due to pregnancy or childbirth each year in the United States. The new federal data even shows that the nation's maternal death rate rose significantly yet again in 2021. And we should add that the rates among Black women are more than twice as high as those of our counterparts. So we just cannot put women in a position to where we are, to where they are sacrificing their lives in order to give life. It's just simply unacceptable.
You mentioned the racial disparities. What do you believe contributes to that when it comes to maternal deaths, and what should be done about this?
Yeah, so this is where the conversation of weathering comes into play. The repeated exposure to socioeconomic adversity, political marginalizations, racism, and perpetual discrimination can harm health. Looking into research, the average white woman is considered to have the most fertility and the lowest risk of unhealthy pregnancy and neonatal mortality when she is between 20 and her early 30s. However, for Black women, this peak of fertility and point of lowest risk research shows in our teens. So in other words, Black women in the United States were more likely to have healthy pregnancies in our late teens than in our mid-20s. So what is the solution? First off, we have to listen to Black women, and we have to trust Black women in this situation. We have to start off by engaging Black communities and those that support us in the development of maternal and women's health programs. As of one of 5 aims for healthcare quality improvement, equitable healthcare is an essential pillar of healthcare quality. So to address maternal healthcare disparities, the MMMRC recommended relevant stakeholder organizations to coordinate efforts to use the upstream approaches that identify and address inequities in the healthcare systems and communities. So in these efforts, Black communities must be at the center of program planning, because if we are not protecting those who are the most at risk, which is Black women, then no one is protected essentially.
How do you think having consistent Medicaid coverage throughout the pandemic has made a difference to the lives of Texas mothers?
Yeah, that's a good question, because in the response to the COVID-19 pandemic, when the federal government declared a public health emergency, the PHE, and passed a law that allowed the people to automatically keep their Medicaid coverage until March 31st of this year, what they did was allowed almost 3 million Texans, mostly children, young adults, and new moms, to access consistent healthcare insurance. I read an article that was reported by the Texas Tribune about a mother her name is Alexandra Robertson. So just a summary of her story. She returned from vacation back in January of 2020 to learn that she'd been laid off from her corporate job. Her car was totaled, and at the same time, she found that she was pregnant with her first child. So what Robertson assessed was crucial healthcare during and after the pregnancy and straight through her next pregnancy. She expressed that she actually expressed that it put her at ease to know that she had coverage, and expressed that her second pregnancy was the best one she had. So this is just a living testimony of how important it is to listen to the mothers and listen to the people who are living in these situations and scenarios.
Uduak-Nakaga, we'll have to leave it there. Thank you so much for your time.
Thank you so much, and thank you for having me.
Texas Attorney General Ken Paxton testified in front of the state Senate Committee on Border Security today. They discussed multiple bills that have been filed related to the border, like one proposal that would grant federal Border Patrol agents the authority to carry the power to arrest and detain those who may be in violation of state law. Paxton touted his lawsuits against the Biden administration.
We have numerous other cases pending, and I'm confident we'll prevail in many of these. As Attorney General, I will do everything I can to improve public safety, uphold the rule of law, and protect the people of Texas.
Paxton told the committee that Texas could also explore options to ensure its best chance of winning a potential legal battle. U.S. Customs and Border Protection released the latest report on migrant encounters for February. Border Patrol agents encountered migrants just over 128,000 times at the southern border last month, a two-year low for a second month in a row. That number of crossings between ports of entry was just over 221,000 in December. CBP officials say 25% of encounters in February involved individuals who have tried to cross the border before at least once. CBP's acting commissioner Troy Miller attributed the drop in part to the Biden administration's new border enforcement measures. And since the Biden administration instituted a new legal process for up to 30,000 nationals per month from Cuba, Haiti, Nicaragua, and Venezuela to come to the United States, government data shows the number of encounters of those using illegal means to enter continue to drop. Karina Capabianca has more.
The program for nationals from the 4 countries allows them to stay in the U.S. for up to 2 years and includes authorization to work if they fill out and meet all of the necessary criteria. At the same time, it disqualifies those who use unlawful methods to enter. Immigration attorney Leon Fresco says it appears the program is working.
The policy is working as intended, where you're seeing a dramatic reduction of Cuban nationals trying to go to the southwest border without permission.
According to data from U.S. Customs and Border Protection, Border Patrol encounters of Cuban nationals at the southwest land border dropped from about 43,000 in December before the policy was announced to 176 in February. The U.S. Coast Guard Southeast, which shares a weekly wrap-up on crews patrolling the Florida Straits, Windward and Mona Passes, said from March 3rd through 10th, Coast Guard crews repatriated or transferred 75 people to Cuba. That number was 420 January 20th to 27th.
Anecdotally, I can tell you that there are still people trying to come by sea. That has not ended, but that number too is less than it was before.
Fresco says demand for the legal program is strong, but that there are some challenges for those applying.
The 2 biggest problems are finding a sponsor, having that sponsor be financially capable of applying for the person, and secondly, how does one navigate the process where it's the foreign national in Cuba that's supposed to fill out the part for themselves? Do you wait to get internet and fill that out, or do you just go ahead and do it for that foreign national?
20 states, including Texas and Florida, have filed a lawsuit against the Department of Homeland Security over the program. Fresco says if the Biden administration can show consecutive months of foreign nationals using the legal process rather than illegal means, it may make a case to Congress or even the courts that they are effectively tackling the problem. In Washington, Karina Capabianca, Spectrum News.
Still to come on Capitol tonight, concern for the LGBTQ community, why advocates are worried about some bills under consideration at the Texas legislature, and rolling back worker rights, why some Texas lawmakers want to return small business regulation to the state. Welcome back. Let's get a check of other political stories making headlines today. The Texas Senate unanimously passed a bill to increase penalties related to the sale and production of fentanyl. It would classify fentanyl overdoses as poisonings, which would let prosecutors to charge fentanyl producers and distributors with murder. Addressing fentanyl overdoses is one of Governor Greg Abbott's legislative priorities. Meanwhile, former Flower Mound State Senator Jane Nelson has been confirmed as the Texas Secretary of State. Nelson, who was the longest-serving Republican woman in the Senate, was nominated by Abbott after his first 3 choices never got confirmed. She will serve as Texas's top election official, issuing guidance to county election officials and working with local election administrators to update voter rolls. The office also oversees state business filings and serves in a diplomatic capacity. And Texas Attorney General Ken Paxton is appealing a court's decision so the state can resume investigating families who provide gender-affirming care for their children. The state has been stopped from investigating by an injunction from the court. This comes as the Texas Senate State Affairs debated a bill today to ban such medical interventions for minors. Joining us now to discuss some of these bills is Ricardo Martinez. He's the CEO of Equality Texas. Thank you so much for your time. How do these bills, particularly when it comes to gender-affirming care, affect children in the transgender community?
I think there are very many ways. I think the first one that comes to mind is just the stigma that comes as a result of debating someone's humanity publicly, right? And really getting into the private medical decisions of a family. We have seen, at least from the Equality Texas perspective, as the largest statewide organization that champions LGBTQ equality, we try to help our community. And we've been getting a lot of calls about the marked increase in bullying, harassment, physical assault, discrimination that has become pretty rampant and commonplace in Texas over the course of the last couple of years.
What is your biggest concern this legislative session as Republicans pursue these bills?
For me, I think about values, right? In a state that values freedom, I always, in the back of my mind, think about why government is intruding into families' private medical decisions. Dealing with any medical decision is really difficult. It involves a lot of care and consideration with doctors and family, but it does not and should not involve calling your senator or your representative to obtain permission for you to do what you think is best for your child.
Now, some of these Republican leaders that are pushing some of these bills will say they were elected to push this forward, to pass this legislation. What's your response to that?
I would respectfully disagree. I think that lawmakers are elected to do the most good for the most amount of people in the shortest amount of time without compromising any community, right? And so when we are actively engaged in, supporting legislation that you have heard countless testimonies around that harms people, I think we are doing a disservice to all Texans.
What have you heard from families regarding how providing gender-affirming care helps their children?
One of the biggest misconceptions that there is that there are some healthcare interventions that happen before puberty, and really supporting, affirming your child and their gender identity sometimes is just a social transition that allows kids to dress differently or get a different haircut. And that, I think, is what a lot of folks are missing. And when you allow kids to express themselves and be authentically themselves, we know that they thrive. And a lot of parents share that testimony, those stories, that their children went from being incredibly upset or to just being free, authentic, and happy.
Are there any bills this session that stand out to you that would support LGBTQ Texans?
Yes, for sure. So I know that people are going to focus on the 137 anti-LGBTQ bills that have been filed, and that's awful, right? A increase of 100, almost 100 from last regular session is really concerning. But at the same time that there are some prolific anti-LGBTQ filers of legislation, there are a lot of people doing an incredible amount of good in trying to improve the lives of all Texans, and LGBTQ Texans especially. There are a couple of comprehensive non-discrimination bills that would make discrimination based on sexual orientation or gender identity illegal, and those are wonderful. There are some bills that are floating around that would improve the healthcare access for all people, especially for LGBTQ folks. And there are some bills that have been filed that would increase access to HIV medication and PrEP.
Ricardo Martinez of Equality Texas, thank you so much for your time.
Thank you.
Texas cities have adopted ordinances to support workers, but sweeping state law could roll them back. Lawmakers say bills are needed to provide regulations to small businesses and that regulatory power should be returned to the state. Under the proposed bill, cities would not be allowed to enforce labor laws beyond state requirements. Regulations implemented by cities, like imposing breaks for construction workers, could be scrapped. Labor groups argue the proposal could undo hard-fought measures to protect workers. And still to come on Capitol tonight's cleanup from the bank failures. How the Treasury Secretary says the banking system is faring after the fall of two banking giants. First Republic Bank is getting a lifeline. Federal authorities say a total of 11 banks deposited $30 billion into their accounts. The bank shares plummeted more than 30% earlier today. This sparked fears it could be the next bank to fail. The stock has since rebounded. The U.S. Department of Treasury commended the move, saying it demonstrates the resilience of the banking system. U.S. senators pressed the Treasury Secretary on the status of the banking system today. Janet Yellen testified before Congress for the first time since the government stepped in to help after Silicon Valley Bank and Signature Bank collapsed last weekend. Our Washington Bureau reporter Taylor Popolars has the latest.
Nerves are certainly frayed at this moment.
In the aftermath of the collapse of Silicon Valley Bank and Signature Bank, Treasury Secretary Janet Yellen urged senators Thursday that things are under control.
I can reassure the members of the committee that our banking system is sound and that Americans can feel confident that their deposits will be there when they need them.
Her message comes after the Treasury Department, Federal Reserve, and other agencies stepped in to provide financial support for all customers of the failed banks, even if their deposits were not insured. Yellen reminding Congress the money is coming from fees paid by banks, not taxpayer dollars. The question looming over lawmakers now is whether additional steps need to be taken. Banking Committee Chairman Sherrod Brown stressed customers should remain confident in their banks, but be critical of the industry's influence on Capitol Hill.
The system is sound. The problem, though, is we've had generations now of bank lobbyists pushing Congress, pushing presidents, pushing the regulators to weaken bank safety standards, and then this happens.
Republicans zeroed in on their belief that inflation played a direct role in the banks collapsing in the first place and criticized bank regulators for not seeing a storm brewing.
Were they asleep at the wheel? Many have suggested that banking regulators need to focus more on regulating banks, protecting depositors and taxpayers instead of straying off course.
Progressive Democrat Elizabeth Warren pointed fingers at both Congress and the regulators for relaxing banking regulations.
We've heard a lot of Republicans say that this collapse wasn't their fault, but Congress handed Chair Powell the flamethrower that he aimed at the banking rules.
The hearing produced more questions than answers. Lawmakers will continue to debate whether a 2018 change that eased certain banking regulations should be reversed, and members could decide to pursue legislation that would broaden who is eligible for federal insurance on bank deposits, but it's unclear whether that will happen. In Washington, Taylor Popolars, Capitol Tonight.
And that's going to do it for this edition of Capitol Tonight. Join us tomorrow for the very latest in Texas politics. Until then, thank you for watching and have a good night.
Thanks for watching our YouTube channel. For more refreshing stories about your community, click the subscribe button over here. You can also download our Spectrum News app and tune in to Channel 55 on Dish and DirecTV to get live news coverage, weather updates every 10 minutes, and more. We'll see you then.